how do you think about fasting? Obviously, you're not totally stressed about having no calories or nothing right before bed, but how do you look at that period at night before bed? And then when do you break your fast?
Yeah, so when fasting came on the scene heavy about 5 or 6 years ago, I was all over it like everybody else was at the time. But what I realized very quickly personally, and for a lot of my patients, is that they were not getting enough calories in during the day, and they were starting to lose muscle mass, lean body mass as a result of it. So you had these people, and I was one of those, is that my lean body mass started going down pretty significantly. And I found that long time. So I think there's different types of fast, right? There's intermittent fasting, there's 48-hour fast, 72-hour fast, 5-day fast, or all these different types of things. And so in general, I do think that periodic fasting can be very helpful, but I don't think that we should be doing this all the time for most of us overall. I think it could be a great reset for people when they're on their journey. And this was a great reset for me initially from a cognitive perspective. Actually, my first 72-hour fast was this sort of awakening moment for me. I was like, holy crap, my brain can feel this way. Like, this is amazing after 3 days of not eating. And so I think and we know the benefits of about a 72-hour fast overall. This is great, but I don't think people should be fasting as much as maybe people think they should be fasting, is what it comes down to. And I also, used to think that skipping breakfast wasn't a big deal, and that people can start eating at 12 or 1 o'clock in the afternoon, have their feeding or eating windows between like 12 and 6 or 8 o'clock. But in general, we are more insulin sensitive in the morning when we wake up. And so what I found over the years is it's better to have maybe a meal in the morning and then not eat until dinner kind of deal. So instead of having, multiple meals during the day overall. Um, personally for me, I will eat less during the day overall. I'll have a bigger dinner and I'll have a breakfast, but I don't, sometimes I'll have not a big breakfast, but depending on the day. But in general, I think we've kind of like everything else in like these kinds of worlds, people overdo it, right? And I saw this happening over and over again. So for me, I do periodic fasts. I'll do like one quarter every quarter. I'll do a 72-hour fast, and that's it's good for the brain as a way of remembering that you don't have to eat all the time, and it's obviously good from a recycling autophagy and recycling the immune system and the gut and everything else like that. But from an intermittent fasting perspective, what I recommend for most of my people, my clients these days, and personally, is having a good breakfast, but trying to finish dinner relatively early as well. And so you don't have to have your breakfast immediately when you wake up. Sometimes we'll do, fasting cardio in the morning, even fasting, lifting weights can be helpful in some people depending on the person. Like, it's very individualized, right? Depending on the person overall. But yes, I'm having some very, very small amount of calories at night, like if I'm having a little bit of collagen overall. And then the honey piece is great for people that have really overstressed, sympathetic overstressed as well, because, or they have an issue with their blood sugar dropping in the middle of the night. The problem I found also with fasting is that if people weren't eating, and especially if they're doing a ketogenic diet at the same time or very low carb, is that they weren't getting enough carbohydrates at night, and their sleep was suffering pretty dramatically as a result of that. So in those people, I was convincing them to have like a little bit of a tablespoon of honey at night just to help them sleep, because it's also another way that the body is going to go into more of a parasympathetic mode. So I don't mean to make this complicated for people, but I don't think there's a one size fits all, in the sense that I think some people do great with intermittent fasting and having an eating window from 12 to 8 o'clock every day, or 12 to 6 o'clock every day, whatever it might be. But I find that overall, over the long term, that's not the greatest for most people. But when they're first starting their journey, like for example, if like they're just starting to work on their diet, that's actually a great way to do it. It's a great way to say, hey, you know what? Don't eat breakfast. Just eat from 12 p.m. to 6 p.m. every day, because it's very difficult for them oftentimes to get as many calories in at that time. And then they start dropping weight pretty easily initially. And then we start optimizing their diet and their lifestyle, their behaviors. And that's when I typically shift them to having more of a breakfast, having an earlier dinner, and then the breakfast doesn't have to be immediately when they wake up, but they're having more of a window, maybe around 6 p.m. until maybe 9 or 10 a.m. in the morning, when they're actually having their breakfast, that kind of thing, right? Not having it at 5 o'clock in the morning or something when they wake up. So I think I probably made that complicated for people, but there's lots of nuances there.
No, that was great. And I think your journey with intermittent fasting and the way you look at it is very similar to mine. And I love that you brought the individual aspect in and beginning of the journey for people, because we are in a world today where 90+% of people are metabolically unhealthy, often overweight. So if you're in that boat and you're coming to this conversation, intermittent fasting, along with low carb or keto, along with potentially restricting calories are your power tools.
100%. Yeah.
For somebody like me or you who's been in this world a long time and we maintain a regular body weight, it just makes sense we're going to have that evolution, a way of looking at it. So I love the way you actually got into the nuance there and brought that all together.
The big thing I found in patients and personally was lean body mass. Like if you're losing muscle, this is not a good thing. Especially as we get older, it's harder to put muscle back on. And there's something called sarcopenia, which is the losing muscle as we get older. And you have a much higher risk of having an injury if you have less muscle on you. So there's been a big shift in the health and wellness community over the last several years. I'm sure you know about protein being king, right? And protein, protein, protein. We need to have more protein in general. And like everything else, there should be probably more of a balance than we talk about. But I do realize that protein is an issue for many, many people. And many of us are not getting enough protein in on a day to day basis. And as we get older, it gets more important because our protein requirements go up as we get older to maintain a certain lean body mass overall. So my overall shift has been less fasting, higher on the protein, increasing resistance and muscle growth, lean body mass. I don't think you need to be gigantic. I don't think you need to have gigantic muscles. And this could be, there's a potential over time that this could be even more detrimental, I think, because you have all this muscle mass. And if you don't maintain it, what's going to happen to it, right? And so I think that there's a sweet spot there. And that's always a challenge for people, right? Because it's, oh, I just want to have huge muscles. Oh, I just want to be lean and be able to run marathons. We're a society of extremes, as you know, Jesse, and the real deal is going back to the basics and the foundation as much as you can. And then if you also, the big piece for me is, well, show me the money, show me what's going on in your data, what's going on with your laboratory analysis, how well optimized are your cells? Can you make energy effectively? Are you detoxing from the energy that you're making well? How is your gut doing? How are your hormones? And it's not that I don't care what you're eating, but I do care what's happening in your cells because that's what I do as a clinician. As I go back to cellular medicine, I optimize what's going on there. And then from understanding what's going on in the cells, you can get a sense from what people are doing, how they need to modulate and modify over time. And like I've seen these trends, and when I was looking at, when the ketogenic diet came out and I was checking people's stool analysis, everybody was just shitting out fat, right? Because too much fat in the diet, what's going to happen is that you're not going to be able to process all that fat. You're going to be pooping it out. And if your poop is floating on a regular basis, that means you have a lot of fat in your stool. And so what do I have to do? I had to tell people either come down on the fat they're eating or start taking more digestive enzymes to break down the fat that they're eating overall. And so depending on the person, depending on the situation, we do what we have to do to optimize that. But if you have a lot of fat getting into your large intestine, you're going to start getting bacterial overgrowth and things that you don't want in there and getting more flatulence and, clearing out rooms when you fart, that kind of thing. And so that happens with protein too. Protein farts are a real thing. Everybody listening, many people have heard about protein farts, right? Like this is the thing. Like if you have like too much protein and you're not digesting it well, you're going to get protein products in your stool. And that's also going to cause issues with bacterial overgrowth and other kinds of things too. So the key with all of these things is couch what you're doing in the data that you're collecting and seeing how things work over time. And this is what I do in clinical practice when I work with patients, because that's how you get a feel for what's actually working, what might be when you're overshooting and undershooting and things like that.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
The challenge is that if you have mitochondrial dysfunction, you have issues with fertility, you have brain fog, concentration issues, you have cardiac issues, liver detox issues, exercise-induced fatigue, all these things. And so working on mitochondrial function is so, so important. Insulin resistance actually